In this class today we will study the anatomy of the urethra. Urethra, as you know, it's an outlet channel starting from the urinary bladder when it opens outside. This urethra shows differences in males and females. For the obvious reasons, the male urethra will be longer compared to the females because of the presence of penis. And we will start with the female urethra and its significance. The female urethra is about 4 centimeters long. I was talking to you about the structures which have this 3.8 to 4 centimeters in length, like inguinal canal, anal canal, and now it is the urethra. In case of females, the entire urethra is quite short and wide. Because of this width, any stones will be passing out of the bladder with ease. Now, it extends from the neck of the bladder and then up to the vestibule anterior to vagina where it opens. So this urethra will pass through two diaphragms, the deep perineal pouch and the urogenital diaphragm, and outside it is surrounded by the external urethral sphincter. In the next slide, we are showing a sagittal section of the pelvis. Please remember the order of the pelvic organs with reference to the symphysis pubis. So immediately behind the pubic symphysis is the urinary bladder, and lying on top of the urinary bladder is the uterus because of its angle, which is called anteflexion. And then posteriorly we can see the rectum, which we have studied. So always you should count the pieces of sacrum like S1, S2, S3, then we know that that is the place where the rectum begins. And it is also showing the Douglas fold. And if you look at the urethra, it is passing through the deep perineal pouch and is opening into the vestibule anterior to the vagina. The urethra is often catheterized. Well, as you see, the slide says it's performed in order to remove urine from a person who cannot urinate, maybe because of some block to the urethra, or sometimes if we want an uncontaminated urine sample, also we can straight away take it from the urinary bladder. In the next slide, we see the various ways to approach the urinary bladder. Pubic symphysis, as I told you, it is a good reference point. So immediately above the pubic symphysis, that is suprapubic region, if we insert a needle straight, it will pierce the urinary bladder and it will enter the bladder. The other way to enter the bladder is through the urethra. So transurethral. This transurethral is a bit difficult process because of the variations in the diameters of the urethra, male urethra. In females, of course, it is easy because it is widest most dilatable part and quite short indeed. But in case of males, there will be a difficulty in catheterization. Coming to the male urethra, you can see that it's about 18 to 20 centimeters in length because of the penis, and it extends from the beginning of the urethra, it is called the internal urethral orifice. That is, if you remember the anatomy of the urinary bladder's interior, there is a triangular area called trigone, and the apex of the trigone, that is the beginning of the urethra, and this opening is called the internal urethral orifice. And then it will pass through prostate, then through the urogenital diaphragm, that is it in the deep perineal pouch, before it enters the bulb of the penis, and it will traverse the corpus spongiosum, where it will be called spongy urethra, before it opens at the tip of the glans penis. We have two diagrammatic representations in the next slide. On the left side you can see a coronal section. Here he says frontal section, both are same. We can see the interior of the urinary bladder with the openings of ureters in the posterolateral angles and the internal urethral orifice, and that is where the urethra is beginning. Then it will pass through the prostate, and next it will pass through the deep perineal pouch, that means through the urogenital diaphragm, before it enters the bulb of penis. On the right side is a sagittal section to show the various parts of the male urethra. In the next slide we are looking at a sagittal section of the male pelvis, and we can see the various parts of the urethra, a pre-prostatic part, prostatic part, and this part of the urethra which passes through the urogenital diaphragm is called membranous part of the urethra. Then it will pass through corpus spongiosum to form the spongy urethra. If you trace the spongy urethra towards the surface, towards the glans penis, you can see that it shows a dilatation. It's called navicular fossa. That is one feature of the spongy urethra. Clinically speaking, there is a continuity of the mucous membrane starting from the tip of the glans penis across all the parts of the urethra up to the urinary bladder. So any infections of the glans penis, for example, sexually transmitted diseases, they can spread from the glans up to the urinary bladder and sometimes beyond as well. Typically, many of the textbooks mention only three parts of the urethra, that is prostatic part, also called prostatic urethra, membranous urethra, and spongy urethra. But they have also described in the beginning of the urethra from the neck of the bladder, and that part is called pre-prostatic part. So pre-prostatic part, prostatic part, membranous urethra, and spongy urethra. The prostatic urethra is homologous with the female urethra. So it is also 4 centimeters, 3.8 to 4 centimeters in length. Developmentally also it's same, and it will pass through the prostate gland, and it's also the widest part of the male urethra. It is easily dilatable, easily approached, but membranous urethra, which is passing through the urogenital diaphragm, and we have described it as a content of the deep perineal pouch. It is the shortest and narrowest and least dilatable. That means it will offer some resistance if we are trying to catheterize transurethrally. Finally, the longest part of the urethra, that is in the corpus spongiosum, which is also called the spongy urethra. Very well, this is a repetition of the diagram which we have seen to indicate the various parts of the male urethra. You are advised to write an assignment on the prostatic urethra because often asked question as a short note for you. Prostatic part, first we will come to the length, that is about 4 centimeters, and it is the most dilated part of the urethra. But in addition to that, it will present some additional features. So, opening into the posterior part of the prostatic urethra is a longitudinal ridge that's called urethral crest. And urethral crest presents an elevation with a slit-like opening. This is called colliculus seminalis, and on either side of this there will be pinpoint openings of the ejaculatory ducts. So that is why the urethra serves as a dual passage for urine as well as the gametes or the sperms. This is a reflection of the urogenital system, uro and genital. Then there is an extension coming from the posterior surface of the prostatic urethra. It's a blind end really, it's a cul-de-sac, and it's called prostatic utricle. This prostatic utricle represents the remnant of paramesonephric duct in males. For this reason, it is also called male utricle or male uterus, because the paramesonephric ducts will form the uterus and the cervix and a part of vagina. And in males, of course, it will regress, but it will remain as a remnant which is seen in the prostatic urethra in the form of prostatic utricle. In addition to these features, the prostatic gland itself, all the acini which are adding to the bulk of semen, these glands will be opening on either side as well. In this diagram, we can concentrate now on the prostatic urethra. There he is showing a prostatic utricle, and below that the openings of the two ejaculatory ducts and the urethral crest. To see the prostatic utricle, naturally because it is coming from the posterior surface of the urethra, we have to cut in a sagittal plane to show, and in the right diagram, right side, we can see the prostatic urethra, and there is a small extension, that is the prostatic utricle. Coming to the membranous urethra, as you can see that it is passing through the urogenital diaphragm or the deep perineal pouch, and there seem to be two glands which are opening, which are flanking the urethra, membranous urethra. These glands are called bulbourethral glands or corpus glands, and the glands are situated here, but their ducts will be opening in the bulb of the penis. So glands are in the deep pouch and the ducts are in the superficial perineal pouch. In the next slide, we are looking at the base of the bladder, that is the posterior surface of the urinary bladder, where we see medially the ductus deferens, which will dilate before it joins the duct of seminal vesicle to form the ejaculatory duct. So that's called the ampulla of ductus deferens, and the duct of seminal vesicle, both of them join to form an ejaculatory duct on each side, and both of them will pass and open into the prostatic urethra. In the next slide, once again a sagittal section of the male pelvis. It's mainly to show how the tail of epididymis is continuing as ductus deferens or vas deferens from the scrotum. It will pass through the spermatic cord, being the most posterior structure, and we can feel also, and we take this relationship with the spermatic cord during vasectomy. One small incision on the back of the spermatic cord, we can hook the ductus deferens, and then it will pass into the pelvis and it will cross the ureter at the base of the bladder before it joins the duct of seminal vesicle to form the ejaculatory duct. In the next slide, we are looking at the descriptions of the rest of the parts of the urethra. Membranous urethra, which passes through the urogenital diaphragm. We can also say it is passing through the deep perineal pouch, and it's surrounded by the axillourethral sphincter and the perineal membrane. You remember perineal membrane as the inferior fascia of the urogenital diaphragm. Next, the spongy urethra will pass through the corpus spongiosum, and it shows another dilatation at the beginning, at the glans penis, which we have already mentioned, that is the navicular fossa, before it opens at the external urethral orifice, which is somewhat vertical anteroposterior in direction. And the bulbourethral glands, the ducts of them, they will open into the proximal part of the spongy urethra, which I have already mentioned, that the glands are in the deep pouch and the ducts are in the superficial pouch, because the bulb and the two crura, which form the roots of the penis, they are situated in the superficial perineal pouch. Coming to the arterial supply, since it is starting from the urinary bladder, so it will be supplied by the arteries of the bladder, that is inferior vesicle, and in case of females, since the urethra is opening anterior to the vaginal orifice, so the vaginal arteries also will supply. and these arteries are followed by the veins of the same name. And since the arteries are coming from the internal iliac in the way of internal pudendal, so the lymphatics will be going to the internal iliac and also the deep inguinal lymph nodes. Here there is one point I would like to tell you. If you remember the femoral sheath, we say that there is the medial most compartment is called the femoral canal, and in this canal there is a lymph node called lymph node of Cloquet, which belongs to deep inguinal lymph nodes, and the glans spinous or glans clitoridis, as the case may be, they will be draining into this lymph node, which is called the lymph node of Cloquet. Some people call it lymph node of Rosenmuller also, whatever, but it doesn't belong to superficial group of inguinal lymph nodes, but it belongs to the deep group. And the pudendal nerve has to supply the urethra, and as we trace it up, the prostatic urethra and all, they will be supplied by prostatic plexus in males, and in addition to pelvic splanchnic nerves.